Volunteers are the lifeblood of this clinic. Without all of you, CDA Cares could not happen. Thank you for your time, compassion, and expertise. Please make patients feel welcomed and respected. We are all volunteers working together. Please be flexible, patient, and understanding. If you have a question or a patient asks you a question you don't know the answer to, ask someone in a white jacket, management team, or someone in an orange shirt, an area lead. CDA Cares offers the following services: cleanings, fillings, extractions, root canals on front teeth, dentures and stay plates, oral health education, and resources for finding a dental home. We do not provide crowns, bridges, whitening, braces, or implants. The main goal of CDA Cares is to relieve pain and eliminate infection. The care provided should follow this basic principle. In most cases, we will not be able to provide all of the care each patient needs. We are trying to do the best good for the greatest number of people. Patients will discuss concerns in dental triage. Triage will assess and, if necessary, send the patient to X-ray, where a dentist will rank treatment priorities. Clinical volunteers should focus on first priority, but can check with the area lead and use professional judgment to determine if time allows for additional care to adjacent teeth. Please be sure you have an X-ray for each tooth you work on and make clinical notes if anything unexpected happens during treatment. Treatment not circled in red must be authorized by routing. Please do not promise treatment to any patient you are not delivering yourself. Patients should be escorted at all times, and the escort should carry the patient's chart. Patient records are property of CDA, and patients may have a copy but should not leave the clinic with the original. Please only use blue pen on the patient form. If patients are given a copy of their chart and come back for additional treatment, the new writing will appear as blue, allowing data entry to know that this is new treatment on a copied chart. If you have a medical emergency, alert your department lead immediately and stay with the patient. EMTs are on site. Alert your department lead if you need security. Turn dental chairs on their side to adjust. This will prevent a serious pinch injury. And please don't bring food or drink onto the clinic floor. This is an example of a denture patient. Many lives will be changed because you care enough to give your time. Be sure to respect patient privacy. Please do not share individually identifiable information on a patient's health status or treatment the patient has received or will receive. Any information you see or hear that a patient sought treatment at CDA Cares. When patients register for CDA Cares, CDA obtains authorization to use their photos to advertise and/or promote CDA Cares. We ask that you use caution in taking or posting any photographs to your own websites or social media sites without express written authorization from the patients who are also shown in the photos. We use a card system to move patients in the clinical areas. This increases clinic efficiency because the providers don't ever have to leave the treatment chair. Community volunteers are assigned to look for these cards and take the patient out of the chair or bring a patient to the chair. At the clinic, wear jeans, scrubs, or other comfortable pants and comfortable closed-toed shoes. You will receive a CDA Cares t-shirt that you are required to wear unless you have purchased CDA Cares scrubs or received a scrub jacket by sponsoring a chair. Take breaks when you need them. Check in with your department lead before leaving the floor. Many people touch the patient chart. Please protect your health and wash your hands and/or use hand sanitizer often. Volunteer food and drinks are available at all times in the volunteer lounge. Please do not bring food or drinks, including water, out of the lounge. Please leave your personal belongings at home, as we do not have a safe place to store them. They may become contaminated if they are on the clinic floor, and having them at your workstation creates tripping hazards. If you see someone not following precautions, please tell the area lead so the behavior can be corrected immediately. We don't want to compromise the health and safety of patients or volunteers. Never reach into bins with gloved hands. Carefully wipe all debris off instruments. Put all instruments that came out of a cassette back in the cassette and close it. Wear personal protective equipment and wear it properly. Remove personal protective equipment when leaving the treatment area. In a setting like CDA Cares, people have the tendency to feel they won't have the instruments and supplies they need when they need them. Central Supply will keep a table in each department stocked with most of the disposable supplies you will need. If you don't find what you're looking for, ask the volunteer at the supply table in your department. We have plenty of instruments as long as volunteers just take what they need to work on one patient sitting in their chair. If you take more than what you need for one patient, other practitioners will not have what they need. It also causes problems in the sterilization area at the end of the day, when a huge supply of instruments that were not used are all brought back and need to be re-sterilized. Please trust that you will have what you need when you need it. Thank you for coming together to help Californians in need. Please let us know if there's anything we can do to make your experience a better one. If you have additional questions, please direct them to the lead in the department where you are volunteering, or email CDA Cares Manager Robin Alonji at robin.alonji@cda. Questions, please